sexual disorder, and some of the ones that are still in the popular clinical world. All right, so we have 10 minutes before we start talking about the new ASAM criteria. So, Cindy, do we have any questions?
We do. In fact, they are pouring in right now. First, I do want to tell everybody that we will make the PowerPoint slides and a recording of this webinar available. It'll be ready in about a week, probably less than today, and you will get an email from me telling you where to find it. I'm getting a lot of questions about that. Okay, and I do want to tell you that sometimes these questions come in on a specific slide, so I'm trying to refer back to what you were actually talking about at the time of the question.
Well, I probably will recognize it.
I think you will. Okay, so let's take, I've got a question from Michael. How will the DSM-5 change affect treatment programs, especially programs relying on group treatment? That's a big one.
Well, it shouldn't. I'm not even sure that I mean that I don't see any effect that it would change groups that rely on group treatment. I mean, if you want to sort of come back at me about what specifically you were concerned about, but remember, diagnosis is basically saying this person needs addiction treatment, or this person doesn't need addiction treatment, or they need addiction and mental health treatment, or they need addiction and mental health and physical health treatment. So diagnosis tells you they need treatment, but what kind of treatment you get still depends on your assessment of your severity and function. That's what we'll get into with the ASAM criteria dimensions. So there should be no impact on programs whether you are doing group therapy or individual therapy or whatever.
Okay, thanks, Doug. Yeah. Next question. Is the severity index only used for substance abuse issues and not used for mental health detox?
No, severity specifiers, there are severity specifiers in other disorders. I'm only focusing on the substance use disorders and the numbers of criteria that you require for the different levels of severity. As you see in gambling disorder, there's different numbers of criteria for mild, moderate, severe. In substance use disorder, there's different numbers of criteria for mild, moderate, severe, and that would be true for other disorders as well. But severity is something that is across the diagnostic categories, or most of them.
Okay, thanks. How about, well, they're coming in so fast they're hard to read. I keep losing the ones I have in front of me. Would you give a meth use disorder along with a meth-induced psychotic